Anemia. Anemia is when the blood hemoglobin is less than the normal. According to WHO, that is World Health Organization, women whose hemoglobin is less than 12 grams per deciliter and in men whose hemoglobin is less than 13 grams per deciliter are considered to be anemic. Classification of anemia. The first one is based on the cause or based on the etiology. So here we have due to blood loss. This is divided further into acute blood loss and chronic blood loss. Acute blood loss is when large volume of blood loss occurs over a short period. For example, during trauma or postpartum bleeding. Chronic blood loss, on the other hand, is when small volume of blood loss occurs over a long period. For example, hemorrhoids, excessive menstrual loss, peptic ulcers, hookworm infection. The second cause is due to inadequate production of red blood cells, which is seen when there is deficiency of iron, vitamin B12 and folate, endocrine deficiency, bone marrow invasion seen in leukemia, bone marrow destruction seen in aplastic anemia, bone marrow failure, maldevelopment and infective diseases. The third cause is whenever there is destruction of the red blood cells. This is seen in case of genetic disorders and acquired disorders. Secondly, anemia is also classified based on the morphology of the red blood cells. So here we have normocytic, microcytic and macrocytic. Clinical features of anemia: pallor in the lower palpebrae, skin, oral mucosa and palms, edema, tachycardia, which is increased heart rate, fatigue, palpitation, sleep disturbances, irritability, dyspnea, vertigo, nausea, anorexia, vomiting, amenorrhea. Types of anemia. The first one is megaloblastic macrocytic anemia, where there is abnormal erythroblast in the bone marrow and increase in the MCV in the peripheral blood. Cause or etiology of megaloblastic macrocytic anemia. You can remember the alphabets from A to F. So A for alcohol, B for vitamin B12 deficiency, C and D for cytotoxic drugs, E for endocrine dysfunction, F for folate deficiency. Diagnosis of megaloblastic macrocytic anemia. Hemoglobin is reduced, RBC decreased, platelet count decreased, but iron is increased. Treatment includes blood transfusion, treat the infection and the heart failure, and specific treatment includes vitamin B12 and folate. The second type of anemia is pernicious anemia. It is a type of megaloblastic macrocytic anemia caused due to failure of secretion of the intrinsic factor by the stomach. Therefore, vitamin B12 is not absorbed, resulting in vitamin B12 deficiency. Etiology of pernicious anemia is autoimmune disorder of the gastric atrophy, Helicobacter pylori infection. Females are more prone to develop pernicious anemia as compared to males. It is common in 45 to 65 years of age. Increased incidence is seen in blood group A individuals. Pathogenesis of pernicious anemia. Autoimmune gastric atrophy, which results in decreased secretion of intrinsic factor, which decreases binding to vitamin B12. Further, there is failure to absorb vitamin B12, resulting in deficiency. Clinical features. Insidious onset and progression is seen. Diarrhea, infertility, glossitis, soreness of the tongue, pallor, splenomegaly, dementia, degeneration of the spinal cord, paresthesia of the fingers and toes. Treatment includes vitamin B12 therapy and iron therapy. The third type is iron deficiency anemia. This is seen in children who consume large amount of cow's milk. Cause or etiology of iron deficiency anemia includes inadequate diet, iron loss due to bleeding. Clinical features includes glossitis, Plummer-Vinson syndrome, where you see web-like growth in the throat, brittle fingernails, dysphagia, which means difficulty in swallowing. Investigations include sigmoidoscopy, colonoscopy, endoscopy, and barium meal. Management for iron deficiency anemia includes oral iron therapy, that is ferrous sulfate, ferrous gluconate, and ferrous fumarate. The dose is 2 to 3 times per day. If the hemoglobin reduces back to normal, the dose should be continued for 6 months or up to 1 year. But if the deficiency is recurrent, long-term iron supplements should be continued. The second one is parenteral iron therapy, which includes iron sorbitol and iron dextran. The fourth type is sideroblastic anemia. It is an inherited disorder from lack of RBCs and excess of iron, because body is not able to make use of iron which is present in RBCs. Etiology of sideroblastic anemia: hereditary, drugs, alcohol abuse, or toxicity. Clinical features of sideroblastic anemia: presence of sideroblastic rings are seen in the bone marrow. Treatment includes blood transfusions. The fifth type is aplastic anemia. It is a condition in which there is damage to the bone marrow resulting in pancytopenia or abnormal cells in the bone marrow. It can be congenital or acquired. Clinical features include weakness, pallor, dyspnea, which is difficulty in breathing. The sixth type is sickle cell anemia. This is caused due to substitution of valine by glutamic acid at the sixth residue of the beta chain. Pathogenesis of sickle cell anemia: deoxygenation causes the RBCs to become rigid and deformed, therefore resulting in sickle shape. However, it is reversible with reoxygenation. Clinical features: the first one is hand-foot syndrome, that is dactylitis, splenomegaly, chest syndrome, stroke, fatigue, cerebral infarction. Investigations include sickle test and hemoglobin test.